Alzheimer's disease. This disease causes dementia by damaging the brain from the inside out. Sticky clumps of a protein called beta amyloid build up between brain cells, clogging the space they need to communicate with each other. At the same time, a second protein called tau twists into tangles inside the cells, choking off their function. Together, these proteins slowly kill brain cells, starting in the areas responsible for memory and spreading outward. That's why people with Alzheimer's may first forget names or appointments, then lose the ability to recognize family or even speak clearly. There's no cure, but several medicines help manage symptoms. Drugs like donepezil and memantine can make thinking and memory a little easier in early stages. Newer treatments are designed to remove beta amyloid plaques and may slow down disease progression if given early. Alzheimer's is the most common form of dementia, making up 60 to 80% of all cases worldwide. Former U.S. President Ronald Reagan and Hollywood actress Rita Hayworth are among the notable figures diagnosed with Alzheimer's. Vascular dementia. This disease causes dementia by cutting off blood flow to parts of the brain. Brain cells need a steady supply of oxygen and nutrients to survive. When blood vessels are blocked or damaged, whether from a large stroke, a series of small strokes, or wear and tear on tiny vessels, those brain cells die. That damage builds up over time and leads to problems with memory, planning, attention, and reasoning. Unlike Alzheimer's, which starts slowly, vascular dementia can appear suddenly after a stroke, or worsen in steps as more small strokes occur. There is no cure, but the key to slowing the disease is controlling blood vessel health. Doctors focus on managing high blood pressure, diabetes, cholesterol, and heart rhythm problems like atrial fibrillation. Medications such as blood thinners and statins reduce the risk of future strokes. Lifestyle changes, healthy diet, regular exercise, and quitting smoking are essential to protect brain function. Vascular dementia is the second most common form of dementia after Alzheimer's, making up about 15% of all cases. Lewy body dementia. This disease causes dementia when clumps of a harmful protein called alpha-synuclein, known as Lewy bodies, build up inside brain cells. These clumps stop the brain cells from working properly and eventually kill them. Lewy bodies tend to gather in areas that control thinking, movement, emotions, and sleep. This leads to a mix of symptoms. People may have memory loss, vivid hallucinations, tremors, stiffness, depression, and sudden changes in attention or alertness. Lewy body dementia has no cure, but treatment focuses on managing symptoms carefully. The drug rivastigmine may help with memory and reduce hallucinations. Medications used for Parkinson's disease can ease stiffness and slowness, but they can make hallucinations worse. Support also includes preventing falls, managing body functions like blood pressure, and improving sleep routines. Lewy body dementia accounts for about 10 to 25% of all dementia cases in the United States. Actor Robin Williams was diagnosed with this dementia after his death, helping to raise public awareness. Frontotemporal dementia. This disease causes dementia by damaging the brain's frontal and temporal lobes, which control behavior, personality, and language. Abnormal proteins like tau, TDP43 or FUS, build up in these regions and kill off nerve cells. As these brain areas shrink, people may begin to act inappropriately, lose empathy, or speak less, and struggle with word finding. Some become socially withdrawn or compulsive. Unlike Alzheimer's, memory may stay intact early on, while behavior and speech are deeply affected. There are no treatments that can stop or slow the disease, so care focuses on managing symptoms. Language therapy is vital for those with speech loss. Other support strategies include maintaining structured routines, adjusting the environment to reduce stress, and providing help for caregivers. Clinical trials are underway for drugs that target tau proteins or brain inflammation. Frontotemporal dementia is the most common dementia in people under 60, often starting between ages 45 and 65. Actor Bruce Willis and TV host Wendy Williams were both diagnosed in recent years. Creutzfeldt-Jakob Disease, CJD. This disease causes dementia through a rare and aggressive process involving prions, proteins that fold the wrong way and trigger nearby proteins to do the same. These misfolded prions spread rapidly through the brain like a chain reaction, causing brain cells to die and the tissue to break down. Under a microscope, the brain ends up full of tiny holes, giving it a sponge-like appearance. This leads to sudden, severe mental decline, along with problems walking, muscle stiffness, and involuntary movements. There is no cure or way to slow the disease. Treatment focuses only on easing symptoms through pain management and physical therapy. Because the disease progresses quickly, palliative care becomes essential early on. Strict safety protocols are used when handling brain tissue, since prions are unusually tough and can survive standard sterilization techniques. CJD is extremely rare, affecting about 1 in 1 million people per year. MELAS. Mitochondrial encephalomyopathy, lactic acidosis, and stroke-like episodes, or MELAS, causes dementia and brain damage by attacking the body's energy supply at the cellular level. MELAS is caused by a genetic problem that affects the mitochondria and reduces the energy required for brain function. As a result, people experience stroke-like episodes, even though their blood vessels may be healthy. These episodes can damage brain tissue, leading to seizures, trouble thinking, and permanent memory loss. Because mitochondria are located throughout the body, patients may also develop symptoms affecting other areas like the muscles, heart, eyes, and ears. Symptoms often appear in childhood or young adulthood and progressively worsen over time. While there is no cure for MELAS, medical providers will often recommend certain mitochondrial supplements that are thought to help improve the function and energy production of the mitochondria. Other treatments include managing and reducing clinical symptoms. MELAS is extremely rare. While it is one of the more common mitochondrial disorders, these diseases as a group affect only about 1 in 4,000 people. Huntington's disease. This disease causes dementia through a faulty gene that makes a harmful version of a protein called Huntington. Everyone has this gene, but people with Huntington's disease have a genetic error that causes the protein to misfold and damage the brain. Over time, this faulty protein destroys brain cells, especially in areas that control movement, emotions, and thinking. Symptoms usually begin with small behavior changes or clumsiness, but over time, they grow into jerky, involuntary movements called chorea, along with memory loss, mood swings, and impaired judgment. There is no cure or treatment to slow the disease, but symptoms can be managed. Physical, speech, and occupational therapy support day-to-day functioning. Because the disease is inherited, genetic counseling is crucial for family members. New research is testing ways to lower the Huntington protein using antisense oligonucleotides, which are small pieces of lab-made genetic material. Huntington's affects around 5 to 10 per 100,000 people of European ancestry. Folk singer Woody Guthrie died from the disease and brought national attention to its devastating effects. Normal pressure hydrocephalus, NPH. This disease causes dementia by allowing too much cerebrospinal fluid, normally used to cushion the brain, to build up in the brain's internal chambers, called ventricles. Even though the pressure isn't high, the fluid stretches and pushes on nearby brain tissue. This especially affects areas that control walking, thinking, and bladder function. People with NPH often show a classic trio of symptoms: trouble walking, often described as a shuffling or magnetic gait, mental confusion, and loss of bladder control. These symptoms can easily be mistaken for Parkinson's disease or Alzheimer's. The main treatment is surgery to place a small tube called a shunt, which drains the extra fluid from the brain to the abdomen. Physical therapy is also important to help with walking and balance. Early recognition and treatment are vital, since NPH is one of the few types of dementia that may be partially or fully reversible. NPH affects up to 2% of all dementia cases and often goes undiagnosed. Alcohol-related brain damage. This disease causes dementia through long-term alcohol misuse, which harms the brain in several ways. Alcohol lowers oxygen levels in the brain, poisons nerve cells directly, and blocks absorption of vitamin B1, a nutrient vital for brain energy. Over time, the brain's frontal lobes, which handle planning, problem-solving, and judgment, begin to shrink. This leads to poor decision-making, memory loss, and trouble with coordination. Unlike many other dementias, alcohol-related brain damage can sometimes be slowed or even reversed if caught early and drinking stops. The first and most critical step in treatment is stopping alcohol use. Without it, brain injury will continue. Vitamin B1 must be replaced through supplements or injections to support brain function. Recovery is more likely in younger patients and those with strong support systems. Alcohol-related brain damage is estimated to affect about 10% of people with long-term alcohol addiction, often starting between ages 40 and 50. HAND. HAND stands for HIV-associated neurocognitive disorder, which causes dementia when HIV enters the brain and triggers inflammation that harms nerve cells. Even though the virus mostly attacks the immune system, it can also infect brain cells called microglia and macrophages. These cells release toxic viral proteins and inflammation signals that damage brain connections. Over time, this weakens areas of the brain responsible for memory, attention, and movement. Although severe dementia from HIV is now rare, mild to moderate thinking problems still affect many people with HIV, even when the virus is under control. The most important treatment is antiretroviral therapy, or ART, which controls the virus. Cognitive rehab and mental health support can improve daily functioning. With proper treatment, the most severe form, HIV-associated dementia, has become much less common. HAND affects about 30 to 50% of people living with HIV. Before modern medications, severe dementia was more frequent. Today, many cases go unrecognized due to mild symptoms and stigma around HIV. Wilson's disease. This disease causes dementia when the body cannot get rid of extra copper that builds up in the body. Instead of being filtered out by the liver, copper builds up in organs, including the brain, liver, kidneys, and heart. In the brain, it settles in areas that control movement, emotions, and thinking. Too much copper is toxic. It damages brain cells by creating stress inside them, disrupting their energy supply, and eventually killing them. People with Wilson's disease may develop tremors, slurred speech, poor coordination, mood swings, or memory problems. Without treatment, these symptoms worsen and can lead to severe disability or death. However, when caught early, treatment can prevent brain damage or even reverse symptoms, but it must continue for life. Wilson's disease is rare, affecting about 1 in 30,000 people, and is inherited in an autosomal recessive pattern. Because it often appears in young adults, it may be mistaken for psychiatric or behavioral issues. Hepatic Encephalopathy. This disease causes dementia-like symptoms when the liver stops filtering toxins out of the blood. When the liver fails, often due to chronic liver disease like cirrhosis, harmful substances like ammonia build up and reach the brain. These toxins interfere with brain cell function, leading to confusion, slowed thinking, personality changes, and poor coordination. The condition can appear suddenly and range from mild forgetfulness to coma. The key difference from many other dementias is that hepatic encephalopathy can often be reversed if the liver improves or toxins are removed. Managing the liver disease itself is critical. Hepatic encephalopathy affects around 30 to 45% of people with cirrhosis. Studies suggest up to 13% of dementia cases may actually be due to this condition and could be reversible with proper treatment.